Hi everyone, a very good evening to all the aspirants. Just waiting for more people to join in so we can start with the session. It's going to be a very small session, so don't worry. I'm not going to take too much of your time. Hello, Sama Sheikh. Good evening. How are you doing? So just waiting for more people to join in so we can start with the session. Good evening, Shiva Chandran. So here I'll be talking briefly about your MCQ practice, areas you should be focusing on, and I'll be talking about the exam which you just gave. Some of you have given the exam, and another exam is due. So the exam window for the next exam, the exam mock test, the second free mock test at Prepladder Super Speciality will be open from 21st of August onwards. And the registration for that also needs to be done again. So 16th onwards, that is Tuesday onwards, you can start with the registration. So it's a free test. This time also, a lot of students, a huge number of students have given the test. There have been some doubts related to the answers of the question paper. So I have just taken the question paper from the team, and very shortly, whatever doubts you have, you're most welcome to ask me later. I haven't seen the paper yet, so I cannot, in a live session, it is difficult to give the answer to individual things. But whatever errata or whatever clarification is needed, I'll be doing that. In the This weekend is going to be a long extended weekend. We have our Independence Day here, so I'll be interacting with you all and coming out with certain important things for you as well. So good evening, Arjun. So I think people are joining in. All of you who have joined in, please like the video, please like the channel, subscribe to the channel, and we can start. So before I take up your individual doubts, first thing is, lot of students ask, "Sir, we have reached MD level, so why should we doing MCQ practice anymore? We have given a lot of MCQs so far." Yes, you have given a lot of MCQs so far, but you also need to understand that in the last 3 years of your MD days, the residency days, you have been disconnected from the MCQ entrance preparation. And so, when the exams are near, it is important for you to practice questions so that whatever knowledge, whatever theory you have, you can incorporate, you can recapitulate in the MCQ options. It does not act at a cortical level. When you solve MCQs, it acts at your subcortical level, and it makes you understand, it makes you think on the lines of objective options. It's a process, and that process cannot be bypassed. So even if you are a gold medalist in your MD, still you need to solve MCQs. You need to solve, even easy MCQs. Practicing MCQs is important. The source is immaterial. A lot of people ask, sir, there are limited sources. There are question banks available at Prepladder also. In case you are not following Prepladder Super Speciality Q Bank, you follow the previous year questions. Even if you are not doing that also, at least whatever source you can find. Suppose you have a NEET PG based question papers with you, right? You can solve even those questions only for the sake of practice. But practicing the concepts are important, and clinical questions need to be practiced more. Don't run after fact based things unless they are an actual previous year question. Right, so there is a limit to the fact-based things which you can remember. So solve more and more clinical questions. That is one advice from my end. Second thing is regarding the mock exam. When you sit in a mock exam, first of all, you learn about the time management. Secondly, you learn about uh, if you are able to solve questions of a particular system which you have read so far, it is a confidence booster for you. In case you have read about a particular system and still you are unable to solve questions from it, it is a reality check for you that probably the material which you have read or the accuracy with which it should have been read, that is missing. And so you can do course correction. So source is immaterial, but you should be doing MCQ practice. With the exam only being about 3 weeks away, I think you should be focusing 80% now on theory and 20% time for MCQs. That is my sincere advice. So other than that, whatever doubts, whatever things you want me to discuss, I'm here. So, yes, some of the queries are coming. Hi, Raghavendra. Good evening. I hope you're doing fine, Raghavendra. So, Naveen Venkat is asking, Sir, my rank is 44. I am planning for one more revision in last 15 days. Anything needs to be added? Yes, Dr. Naveen, a lot of things can be done at this moment. At this moment, your focus should be on things which have a high frequency of getting repeated. So, if you look at the last two or three papers, there is always a trend. First of all, identify low open Nelson and start from chapter number one, go till the end, bibliography part of Nelson, and try to see are there systems which you have missed out upon. The systems which are often missed by residents. Everybody does neonatology, everybody does general pediatrics, everybody reads cardio, nephro, neuro, etc. But people miss out on pediatric vasculitis. People miss out on pediatric rheumatology. Have you read JIA, juvenile idiopathic arthritis, and juvenile dermatomyositis properly? Have you read neonatal lupus erythematosus properly? Neonatal LE is a very important topic, has not been repeated in the last 3 years, but all the more important because of the way questions are being asked in the paper. So have it's a very small. If you look at Nelson, hardly one page chapter is there. Not one, I think two-page chapter. But it's a doable thing. So are you thorough with it? Identify pediatric certain orthopedic conditions, achondroplasia, osteogenesis imperfecta, Marfan syndrome, Ehlers-Danlos syndrome. Are you thorough with these? When it comes to hematology, again, people leave out a lot of important topics. Sickle cell anemia, DD of microcytic hypochromic anemia, pancytopenia, the inherited bone marrow failure syndromes. Are you thorough with them? If not, these are the gray areas from where marks leak out in the actual exam. So identify those areas and simultaneously also try to do topics from repeatedly asked areas like PALS protocol. The recent PALS guidelines, there are going to be questions from that. Give a quick reading of frequently asked topics from the AIMS NICU protocol as well as from the AIMS PICO protocol. AIMS PICO protocol is too vast. If, in case you have not read anything about a certain topic, it has been missed out. Do not go into the fine details. At least the diagnostic criteria, treatment of choice, investigation of choice, those bare minimum 10, 12 important points, they are better rather than leaving out the topic entirely. Having said that, in the last paper, there were a lot of questions related to urology, not the nephro part, urology part. When I say urology, you will have the obstructive uropathies, you will have hydronephrosis. There were images given. There was a question on keyhole sign of posterior urethral valve. There was a question on uh, drooping lily appearance. So similar things, they are very easy. You have read them before, but you need to revise them once before you sit in the exam. So having that confidence is important. Lastly, have a look at the recent data, recent health programs. I have already promised in my previous session that a small summary of these last minute database things I will put up on every channel for everyone, like irrespective of whether you are a Prepladder subscriber or not. I will put it up for everyone so everybody benefits from it. So end of the day, it's your battle. A teacher can only tell you, all of you are smart enough, mature enough to understand that the same questions are going to be asked. At least 80% paper is going to be solvable if you go by last 3 or 4 year papers. Among those 80%, if you can target somewhere around 70 or 79%, remaining 20%, calculated risk you take, you reach a score of 80 to 90%, you will get a seat of your choice. It's as simple as that. You would say, sir, आप तो बहुत आसानी से कह रहे हैं. Yes, it is easy for me to say, but at the same time, this is what people do. So right now, don't try to read outlandish topics. A topic which has not been mentioned in Nelson should not be read right now if you are not right now, if you are, you plan to revise the key important topics right now. So stick to Nelson and the important topics asked in Nelson. Try to see what are the systems you have missed out upon. Pediatric orthopedic, certain pediatric skin related conditions, certain pediatric rheumatology conditions. These are the areas which people miss out on. Immunodeficiencies. Please read immunodeficiency. Please read vitamin disorders. Vitamin deficiencies, very frequently asked in every NEET super specialty exam. Read that and you will, plug those gaps. Moving further, Sahil Dhamija is asking, let me just have a look. Sahil Dhamija is asking, sir, in the app, there is no MCQ of pediatric neurology and pediatric oncology. Sahil, uh, as for neurology, I've already told you it happened because of the previous system being there, where pediatric neurology and neurology were clubbed together. So the Q bank of those was common. When it was split from there, and pediatric neurology came into the NEET super specialty pediatric part, then obviously the lot of questions were lost and many of the adult questions were removed. So this is what has been told to me. And in the coming days, obviously time is too less. In the coming days, obviously there will be a proper dedicated Q bank of this coming up. Other than that, as I said, MCQ practice, you can follow any source. Anywhere you find any doubt, you're most welcome to ask me. Last 2 3 days, I was a bit busy. I had some sessions to take, so I was traveling. This weekend, obviously, I'll be free as you. You will be reading whatever doubts you have. You're most welcome to ask. I will be answering all of them. At least 12, 13 doubts are there in my Telegram group, and a similar number is there on the other social media channels, including the Prepladder also you have sent. So those queries, I'll collect all of them. I'll sit down one night and I'll answer individually each one of them. If there is discrepancy between two textbooks, which one to prefer? Our system, our way of medicine is like that. The entire world of medicine is like that. There will never be total synchrony between two textbooks. It is very simple. If it is neonatology, then your Ames NICU protocol and Cloherty carry more weightage than Nelson, number one. If it is mm, an Indian guideline, for example, nephrotic syndrome data is asked, you will favor the ISPN guidelines, not Nelson or any other textbook. But for majority of things other than nephrology and neonatology, and certain parts of government related things like definition etc of severe acute malnutrition, for the remaining 90 95% things, Nelson 21st edition is the final authority. So whatever is mentioned in Nelson, you will first follow that. The exceptions being breastfeeding related guidelines, severe acute malnutrition and its management, nephrotic syndrome, febrile seizures, neurocysticercosis, and neonatology guidelines. These six areas, the Indian guidelines are to be favored over Nelson. I hope I'm clear in this. This has been a doubt not only for entrance exam preparation, but even when we were preparing for our residency final exams. And this is the golden rule which has been taught to me at that time. This is the golden rule. I'm quite sure most of the people who will be who are in top positions, they also follow the same. I know a few people who are now in top positions, but they are all obviously, I'm their student. I'm too young to. But this is what I've heard from the bosses, all the major bosses that you know of, and this is the rule that we follow. So they logically, the similar rule should be followed in the exam as well. Bismillah, Bilal Mansoor is asking, good evening, sir. Put summary of pediatric diabetes. Yes, Dr. Bismillah, for sure. Pediatric diabetes, two-part video. Part one will be related to the diagnosis, management, guidelines of DKA, its monitoring, etc. Part two will be related to complications of DKA, complications like DKA, as well as some of the, there are, I know there are discrepancies between AIMS PICU protocol and Nelson. And ADA guidelines also there is some discrepancy. So the common way out of that will be the second video. So two videos will appear within the next 5 or 6 days. They will be there with you. Anything else? I'm looking at the chat right now and answering. Any more doubts? As the exams approach, your screen time should reduce. But at the same time, you should not overexert yourself. Save some energy for the last week and for the actual exam. A lot of people, what they start doing is they start drinking too much of coffee and they start skipping their meals and reading all through day or day and night. And they're reading 17, 18 hours a day also. Please don't do that. You'll run out of steam by the time actual exam comes. 8 to 12 hours, if you can take out right now, it is good enough, more than enough. In the meanwhile, take some good sleep, take some good diet, occasional walk outside, also see what is happening around you. The social media time should be about 10 to 15 minutes, half an hour if you are attending a live session with me. Other than that, you should be, just taking it easy. If you start panicking and start being um, too overwhelmed by the situation, you will not be able to perform to the optimum level of your preparation. So be calm. More doubts coming. Rupesh Jha, sir, please prepare more neurology videos. Yes, Rupesh, I will do. Infant of Diabetic Mother, I think it has been released. If I don't, or it will soon be released. I'll just have a look now. So, a detailed Infant of Diabetic Mother video I've just created. So, Anshu Arora is asking, sir, shock is different in Pico protocol and Nelson. Yes, Anshu Arora, it is different in Pico protocol and Nelson. So, the common way we have to find. See, it will all depend upon which guidelines you are following. So, based upon guidelines, minor differences will be there. But in exam, examiner is not going to ask you the controversy. The examiner who's sitting, he will also know that Pico protocol and Nelson, there are two different set of guidelines. So he's going to ask you a generalized thing. He's going to give you a case and he's going to ask you what is the next step in the management if a child with hypovolemia is coming to you or septic shock child is coming to you, what is the first step in management? So bolus dena hai, kiska bolus dena hai, that you should know, and how many boluses are to be given maximally, and when you should not give bolus and start inotropic agents, which is the first inotropic agent to start, what is the starting dose and what is the maximum dose. These are the bare minimum things, and if you see carefully, there are not many differences. So those differences you can remember based upon how the options are framed. You will have to take a pick there. So there is no easy way out of this. So controversies, again, I'll try to address. So whatever controversy you find, take a snapshot and send to me, and I'll give my humble opinion, 2 cents on that. What should be the revision strategy for last 15 days for NEET SS? Last 15 days, I think most of you are already following a 1 month strategy for last 1 month preparation. Just stick to that. In case you have not been preparing and you're looking for a magic for the last 14 days, there is no magic, unfortunately. But you need to remember that in this world of muggles, I hope you get the reference. In this world of muggles, you can be a wizard if you are sticking to the basics. Right now, you need to stick to the basics. If you can get hold of the recent previous year questions, solve them. There is a previous year recall video also I have posted. Those topics need to be done. AIMS NICU guidelines, AIMS PICO protocol selectively, PALS guidelines, the recent 2020 update, especially the algorithm related to cardiac arrest, etc., and pediatric tachy and bradycardia management. And the side boxes also, which people miss. Then sticking to the recent updates on febrile seizure, nephrotic syndrome, etc. Recent data. The often asked things will be neonatal jaundice, typical trisomies, and syndromes associated with congenital heart disease. These are the things which are frequently asked, and you need to revise at least once before you sit in the exam. So, next 15 days, try to stick to them, and you will create magic in the paper. Go with confidence. That is the key. Be consistent. That is also key. Anything else? Any more doubts from your end? It won't take much time today because all of you are preparing. Regarding the exam, many of you have given the exam. Whatever doubts you have, ask me. Send on the Telegram group. There is Telegram group I have of my own. There is a Telegram group of Prepladder also. You can put on any place and tag me and ask me, and I'll answer to the best of my ability. Please like and subscribe. Like कितना हुआ है? अरे बहुत कम like है यार. Please और like भेजो भाई so that okay. Anurag is asking, sir, kindly provide sessions animal and other poisonings. Animal poisoning, I'm not sure what you mean by animal poisoning, but other poisonings, if you are thinking of OP and paracetamol and those kind of poisonings, as I've said, for a brief review, OP Ghai or Suraj Gupte or your Piyush Gupta book, either of the three can be followed for a quick review. In addition, acetaminophen poisoning and organophosphate poisoning and opioid withdrawal. These two or three topics and their side effects, obviously, pharmacology part, that needs to be done in details from whatever source you can find. Pharmacology, do not go into too many drugs. Antiarrhythmic agents are important. Drugs used in neonatology are important. So stick to them. Aditya Singh is asking, what is the most common pathogen causing aplastic pancytopenia? Aditya Singh, there is no such thing as aplastic pancytopenia. It is aplastic anemia or it is pancytopenia. So, should one go through NCCN and ICMR guidelines for pediatric oncology? Aditya Singh, if you have time. I don't think you have time for that. And for INI SS, yes, you should. For NEET SS, you can skip. Don't kill me if a question is asked from them, but they are usually not asked in NEET SS exam. ये पैथोजन मोस्ट कॉमन पैथोजन वाला फ्रैंकली मुझे नहीं आ रहा इफ यू ट्राई टू थिंक कि ए प्लास्टिक क्राइसिस कौन करता है तो देन पार्वो वायरस B19 इज द ऑर्गेनिज्म व्हिच कम्स टू माय माइंड बट योर क्वेश्चन इज नॉट वेरी क्लियर सो आई कैन नॉट कमेंट अपॉन इट Aditya Singh, plastic anemia is a misnomer, yes, but aplastic pancytopenia is no scientific term. You please understand that. You cannot create a term just because something else is a misnomer. HMD is a misnomer, but we do use HMD, right? Respiratory distress syndrome. Parvovirus B19, I told you, without you giving me the option. Ribam Gupta, any update on COVID pediatric care guidelines? COVID pediatric care guidelines, COVID is a bit, not in trend. But having said that, at least the latest ICMR guidelines, if you can follow, only ICMR guidelines you need to follow. The most recent update, you can Google and it will be easily available. Right? So I think I've answered most of your queries. For pediatric oncology, please do not overdo oncology. A lot of students they want to be hemato-oncologists and they end up overdoing all the fine points of all these regimes related to chemotherapeutic regimes related to pediatric malignancies. Stick to the basics. End of the day, highly unlikely that fine details will be asked in NEET SS. They are more frequently asked in INISS, right? So if you are targeting INSS, you want to do DM pediatric hematology or oncology, then you need to do in details. Otherwise, for NEET SS, in the last 15 days, stick to only important areas. Aditya Singh, hairy cell leukemia is also misnomer, should be known as B cell NHL. Yes, Aditya Singh, there are a lot of misnomers. The point is, in our medicine world, anything becomes popular, the name just sticks around. Vaginous granulomatosis. Do you know how much long back they had said change the name? Call it as granulomatosis with polyangiitis. Still, 90% sources call it as vaginous granulomatosis. So एक बार जो नाम जो label चिपक गया, that sticks around. So that is human nature. Tomorrow, if Cheteshwar Pujara starts playing, even faster than Rishabh Pant, still the label has stuck around. Still, he's going to have very few takers. So the labels, the names, the pseudonyms, there is very little we can do. But for entrance exam, at least remember the alternative names. IAP guidelines needed, standard treatment guidelines. Yes, KRS, you can do them. Standard treatment guidelines for a variety of disorders are there. You can go through them briefly. Do not go into the details of, suppose they are talking about drug of choice. Just remember amoxicillin. No need to go into कि amoxicillin कितना देना है, 50 mg per kg देना है या 80 to 90 mg per kg देना है. Don't go into those fine details. 2 weeks are left for your exams, about 2 to 3 weeks. So it's a golden time. Anything which you have not read, unless it is absolutely essential, don't go into the details. Uh, I hope I've answered most of your queries. Aditya Singh has retracted messages. Aditya, it's fine. You can post anything. Unless you're not abusing me or anybody, it's fine. See, only when we ask questions, then we learn. कितनी बार ऐसा होता है, people ask me, and I have not read or I don't know about the fact. But I make it a point, I go back, I read. It's a ongoing process. It's an ongoing process. I am also a student. You're also a student. Tomorrow you'll be DM. I'm overaged to do DM now. So technically you will be more qualified than me. But your learning will also continue. My learning will also continue. So don't be ashamed of asking questions ever. Shreyasi Bishwas is asking, is reading Nelson enough for CP? Yes, Shreyasi. CP, cerebral palsy, very nicely given in Nelson. More than enough. In fact, it talks about certain modalities which are actually not done these days, but they are still on the horizon, like deep brain stimulation. Also, it mentions about it. Although most centers are not doing it, but Nelson does talk about it. So rather than going in for random review articles, stick to Nelson itself. CP is very nicely given in Nelson. Any more doubts? All those who have just joined now, please like and subscribe. If I'm going to ask questions right now, the people have just given the exam mock test right now. So next time now, I'm going to have a session next week also. What I'll do is I'll try to take a rapid fire test, not the rapid fire which Karan Johan takes in uh, Coffee with Karan, but it will be a more relevant thing for you. And right now, last thing before we finish the session, last thing, do not get distracted at this moment. When you are distracted from whatever you are supposed to do, there are problems which happen. Some rumors start. Some last minute expert comes out with this is going to happen, this time this is going to happen. Nobody knows a thing. These are all predictions people can make. Certain predictions will come right, certain predictions will go wrong. We do not know how much the weightage is going to be of each area. Focus on doing one proper reading or a rapid reading of all the systems, not missing out on the systems which you have read, and read common things, read askable things for your exam. About the data, I have already told you. Don't waste time on NMR, MMR, and those data. I'll compile it, I'll put it somewhere, but make sure that at least 2 days before the exam, you find that data, whatever has been posted, as a small update, and you go through it once. So don't be distracted. Don't fall into petty things, and don't fall into speculation. Let the examiner put whatever he or she wants. We'll take it on. Hmm. Sir, Barted, if you are told explain is given the AD, which is right, sir. Mohammed Shadiq, I'll just have a look and I'll let you know. Then Hafiz Ahmed, sir, revising QBank helps. MCQ more than theory. Yes, Hafiz, it does help. If you have read theory superficially and you're solving MCQs, retrospectively, it will help you. If you answer a question wrongly, it will make you go back to the theory, and whatever mistake you have made, that point when you read, it will get imprinted in your brain. So that is a very useful way of preparing. Om Sarup is asking, I'm a third year resident. How should I approach for SS next year? Om Sarup, lot of time. As soon as the SS exam is over, I will be coming up with recall session, discussion session, and way out, because this is the first changed pattern super specialty exam which is going to happen in NEET SS. So, what are the areas we should be targeting? A lot will depend upon this paper. So, I'll come out with a detailed strategy on that. Vortex vibe reality. Sir, I'm in class 11 preparing for new UG. Any suggestions? For NEET UG, I'm not qualified to tell, but from what I know is stick to NCRT, do it multiple number of times, do MCQ practice, and follow right people for that. You will get through. Irrespective of whatever exam, if you stick to the basics, revise well, and you're honest with your work, you will get through. That is all I can tell. Pradeep Das Biswas is asking the 5 a.m. club. Sir, prep ladder is enough for first prof. Pradeep Das again, first prof, it's too early for you. Any source which you follow, if you have subscribed to Prepladder, that should be enough for you for in first prompt. End of the day, what source you are following is not important. How good you are utilizing it, that is important. So stick to whatever source you have. If you have enrolled into Prepladder, follow it to the best of your ability, and you will do well. I hope there are no more further questions here. Thank you so much for joining me. Thank you so much. And please like and subscribe the channel. Next week, I'll be coming live again. And this time, I'll be asking some rapid fire questions also. I'll be sharing some data also. And the next session will be a kind of finale session before you sit in your exam. So join me next week. The dates will be announced shortly. And all the best for your exam. Whatever academic doubts you have, please post on my Telegram group or on the Prepladder group and tag me there and I'll answer. Thank you very much. Independence Day to each one of you. Thank you.